that there will be questions for Jason. There were some really fascinating slides which we saw. And what I've asked, and Jason, if you're amenable, because I think it fits very much in the next conversation that we're going to have, if you don't mind staying around. Because what we are hearing a lot, and I think one of the phrases that Jason used was holistically putting the needs of the patient as an individual at the heart of all of this. It was that sort of mind shift, if you like, that was pivotal to all of this. And that's very much what we're going to be speaking about next. People-powered health care. That's the way this session is built. And we have some excellent people to discuss just how you do that, how you put the patient in the centre of all of this. Because as you said, without the stakeholders' buy-in, nothing is going to happen at all. We have with us Soma Stutt, who's the executive lead of 100 Million Healthier Lives. We heard that mentioned earlier today. We have Don Redding, who's the Director of Policy at National Voices, and Kate Julia, who's the Managing Director of Allatt Danlos Support UK, and also Kate Allatt, a really fascinating person. I'll tell you a little bit about Kate before we even begin. Kate, at the age of 39, had an unthinkable diagnosis. As a young mum, she was told that she had locked-in syndrome. Not only did she pull her way out of that, she also became a pivotal player in what we are talking about now, which is patient at the heart of treatment. She was very much an inspirational figure, speaking about the 5-year forward plan. And I will let Kate tell her own story in her own special way. Please welcome our panel.
Kate Allatt from Dore in South Yorkshire had a severe brainstem stroke and then went on to develop locked-in syndrome. Doctors said she'd never walk or talk again, but the mother of 3 defied their predictions.
People suffer from locked-in syndrome, and how hard is it to recover?
Well, it's actually pretty rare.
My speech therapist was absolutely brilliant. However, she did say a week before my tracheotomy came out that Kate would never speak again.
Off we go! Go on, Kate!
In the coma, I was totally unconscious. There was no Disney-fied or anything like that. It was just my life lost 3 days. End of. The psychologist took my friend out of the room, unbeknown to me, and she said, "We have a problem. Kate's expectations are here, and ours are here. You need to bring Kate down to us." And she said, "No, damn you, you need to go up to her." My community stroke team wanted me to practice standing up from seating after I left hospital. Now, I actually wanted to run again by my first anniversary of my stroke. That was in just 3.5 months' time. I thought they were again lowering my expectations. So, being the kind of person I am, she was very nice, but I did sack her. And I blagged free gym membership in return for some marketing work, but unbeknown to me, I was thrown in a personal trainer for free as well. Now, Mike Lee and I worked tirelessly, repetitively, frequently, intensively over the next 3.5 months. And do you know what? In just 6 weeks, he got me out of the wheelchair I was doubly incontinent in. He got me, after another 6 weeks, off crutches altogether. And actually, on my first anniversary of my stroke, I shuffled, as you saw, 10 yards. But you know what? Just 21 months after my stroke, my brainstem stroke, I ran 1.5 miles. It was like a horse, but I did run it. So, but I have to say, when I came home from hospital, I got 3 young children. My youngest was 5. I was lonely. I was isolated. I left hospital after 9 months. They just waved me off. I've had no help, no support, no nothing. I didn't know what I was going to do with my life. I was 40 years old. The people who had come to see me in hospital had gone and dispersed. They'd spent 9 months looking after me in hospital, and as soon as I was home, I was considered well. I wasn't well. I was caught between my old self and my new self with no idea of what I was going to do with myself. On top of that, the post-traumatic stress disorder I suffered. Give you an example. I'd been in Sainsbury's in my wheelchair, but I was actually convinced that was a dream because I was really in the Northern General Hospital in Sheffield, completely paralysed. And then having to come home to be a parent to 3 children who were completely messed up from me not being there for 9 months and after the circumstances, and my husband. I wasn't even well enough to look after myself, let alone the children, but again, no support. But the day I left hospital, as a legacy to my children, because I thought I could get run over by a bus just like that now, I started writing Running Free, my book. It's on Amazon, if anybody wants it. And it was really a legacy for my kids. But you know what? It's a very candid, very in-your-face, very raw, very real story, true story that's turned out to becoming the very big practical guide for anyone affected by locked-in syndrome. It gives people and families the world over hope and inspiration, but practical ideas to help themselves improve their outcomes. I'm very proud of that book. But just 3 months after I left hospital, that's all it took for me to figure out what I was going to do with my life. I figured my way of repetitively, frequently, intensively, obsessively willing myself could help other people. And you know, it really has. Gives hope, inspiration. I give no promises to anybody that are going to do what I've done, just possibilities. I mean, for example, take Christine Waddell. She's the same age as me. When she approached me on a Skype conversation with her carer, she'd been locked in severely in a headrest in a wheelchair, unable to do anything, not eat, for 17.5 years. Okay, we had a conversation, and do you know what? 2.5 years on from that, from the help I also blagged for her, and her ability to work hard, she's changing science. She's actually able to speak a few words. She's in a standing frame. She's doing water therapy. She's able to hold herself up. But you know what? Best of all, up until 2 years ago, all she had to look forward to was 2 vodkas down a peg at night, once a week. But now she's eating 3 meals a day. So much so, she's actually put herself on a diet. And then take Claudia from Poland. I went to go and visit her, 23 years old, had exactly what I had. I spent 3 hours by her bedside, voluntarily doing what I do. And do you know what? She had a bit of belief, a bit of hope, and she had some practical guidance as to what to try. By the time 10 hours later came, I got back to Sheffield, her boyfriend had sent me a WhatsApp of her moving her arm over, and moving her body, and actually mouthing some words. And she's now gone on to do all sorts of other things. So phenomenal, really. But I've also had Facebook groups that have given digital advocacy all over the world, actually. But what's really fascinating is the people that I helped on my Fighting Strokes page and my Beating Locked In page, they're now helping other people. So the cycle of giving just continues, and it's really, really good. I mean, I found that giving and kindness has really helped me preserve my own mental well-being. You know, I've struggled since my illness with all the pressures on me and everything else. It's been huge, but to help others and to try and make a difference to their lives has really helped me stay on track. In fact, I've worked with the University of Nottingham and I've pioneered some peer mentoring research, actually, and electric stimulation research. And most recently, I've just done a TEDx talk on voicing inner thoughts, if you want to watch it. But I do have to say that I do love to give workshops on how to implement self-management in the primary sector. I really feel strongly that patients need to be given the skills, knowledge and expertise and confidence to be able to manage their own chronic conditions. And I worry that they don't. But I also have a very big passion in the integration of mental health and physical health. It's inextricably linked, you all know that, which is why I'm very much involved in a brand new wellbeing digital hub, Sheffield Flourish in Sheffield. I do want to say this quote from Winston Churchill, which I think underpins self-management from a patient point of view. Success isn't final, failure isn't fatal, it's the courage to continue that counts. And that's my favourite quote. But you know what, I'm going to give the last word to the legend that is Muhammad Ali. He said, "Don't count the days, make the days count." And I think I have in the last 6.5 years, and hopefully I continue to. So thank you very much.
Hey. So, Kate, thank you very much. I mean, absolutely inspirational. And you are way out ahead of me. Shoma, stop. No, please do. Because I was just going to say, Shoma, it's really good to have you here because we've been talking about partnerships all morning, partnerships between organisations. But in Jason and in Kate, we've heard about the most important partnership of all, which is a partnership between the patient and their health. And with 100 million lives globally, you're trying to sort of rewire a global think on this. Please tell us more about it.
Thank you so much. And what an inspiring story. And I'd like to begin by thinking and reflecting on that story. Because in 100 million healthier lives, which brings together an unprecedented collaboration of change agents across hundreds of communities, across over 15 countries around the world, who have all said that we need to go from thinking narrowly about a healthcare system to really understanding what it takes to create a health and well-being system, we believe that people are the single most important source of trapped and untapped potential that exists in our communities. They are, in our minds, the missing link between where we are now and the outcomes we hope